Hi, my name is Dr. Gebaynesh Gashaw-Gant. I am a cultural psychologist. I have a PsyD in cultural psychology. I've worked in this field over 21 years. I've worked in clinical settings, in educational setting, and as a counselor. And also, I'm a certified domestic violence counselor. Cultural awareness. This is what I call trust building. Even though we are from the culture, we really need to understand the individual's view of mental illness. How do they see it? What do they think works for them is very important. And so you need to be aware by asking questions to understand where they're coming from. And then, you have to be clear how these differences may cause in diagnosis and treatment, the problems they will bring about. Because if you don't understand them and they're saying something and you are saying another, then you have lost the client. They won't be listening to you. So you really must understand them at this point. You really need to find out what their belief is and what they think is good for them. It's easier, especially for individuals within this community, it's very easier to generalize. I'm from Ethiopia, and I might say, all Ethiopians think that way. No, it is not. In Ethiopia, how many tribes are there? How many, belief systems are there? So you need to ask, even though you are from the community, you need to ask them what their belief system is. How do they see mental illness? And at the same time, expectation. We expect them to be better or to to do what we ask them to do. How would that work? If again the client is is thinking from a different thought perspective, then how are you going to get across your point of if this will work for you? So you need to focus it and gear it towards their thought processes, also their feelings, their wants, their belief. Again, we have the first generation who came here to the United States way back, and we had children that came with them. So they are the second generation, and they have assimilated, they have changed. We don't know. So you really need to identify if it is a young child now, an adult that came as a young child when the first refugees arrived here. You need to understand, how much they have assimilated and how their thought process is again. So what cultural awareness is, what I call trust building. You are building trust by understanding each other, by understanding their point of view, by understanding what their feeling is. Second phase is, stigma. Stigma is, what we hold. So mental illness in these communities has a high stigma. People are told to be, incompetent, not good. So they are just thrown aside and not seen as, fully human, functional individuals. So we have to understand what is, their belief. If it is the belief system says that mental illness stems from the possession of a devil, how are you going to, tell them or convince them or work with them when you're saying, no, the sadness, when you are feeling this way, that is depression. So it cannot be. So you're going to be going again against, their belief system. And you really have to, explain and understand how those two, work together, or how can you integrate your own treatments into their belief system. How are mental illness understood in these countries is, we all know it's a possession. So they know it's a holy water treatment that they use. They haven't seen, they don't think anything can cure it. Yes, but again, we cannot say it can cure it. We can say that it can give relief. Medication, so you have to educate. Medication can give them relief. What does, diagnosis mean to them? Yeah, you really have to be careful here, because when you are putting a label on a person, they already have a stigma about mental illness. So, depression is mental illness. Schizophrenia is mental illness, which they don't know anything about. So you need to explain. They believe to be, I had a client who said, I'm sad all the time. I know what she was meaning. SAD within these communities is, as we know it, is depression, but for them is all the feeling she had was sadness. So I had to integrate that into the clinical treatment of, okay, and educate on depression so that she can understand, wow, they are the same, without actually pushing that on her. At the same time, we need to be careful not to devaluate or ignore what they're telling us, because within this community, what I have found out is that we tend to ignore what they're saying, or we tend to devaluate, to say, oh yeah, that's, in our country, that is, back there, that is that we used to, we think, but it is not. So please be careful not to be condescending, because you will come over. If you're telling them that, oh no, that's not what it is, you are dismissing it. So you are, devaluating what they're saying. So you need to be careful in really explaining to them, I understand where you're coming from. Can I tell you about something, what, the Western world says, what medical treatment says. So I always put it as a medical treatment says, because, there is an option. And so would you like to understand the options that you have when it comes to, mental illness? So this phase, the belief and the stigma and belief phase, is what I call understanding. So now that you have to go into how sensitive you have, cultural sensitivity. Yes, you are from the same culture, but again, like I said, how sensitive are we when it comes to our own, treating our own people? How are we? Because I have seen when I had my own organization, my workers tend to go in and talk to the individuals as, I'm educated, I know now, so you need to listen to me. And you lose your clients in that way. And so when the reports come back to me saying this individual didn't want anything to do, I had to go and meet with the individual and teach them on the process what we need to do. Mostly, it's normal within this community. Once once you're educated, that means you get to see yourself different above. So you start ignoring their feelings. So you start, not looking into their feelings, which is very difficult for them. So you need to listen. Listen. There is nothing wrong with listening. Most of the professionals, it's our job, to listen. But in our community, we have, we know it all. So everybody talks and there is no one listening. So you have to change, and you really have to become a good listening and nod at what they say. Say, I hear you. They need to see that from you. Teach, but not lecture. Meaning that, you start telling them, oh, well, yeah, I know depression is, you feel sad. I know what it is. That's depression. So depression, you feel that, that's a no-no. You need to educate them. Have flyers, handouts ready for your clients, explaining about depression, different, mental illness, and what it means in their culture and what it means in the clinical setting, what it means when it comes to the treatment part of it, or what it is all about, so that they can have a clear understanding. Most of the time, these clients are afraid, so they won't like to be lectured. So if you give them the handout, they can read, or you can read it for them right there. And, give it to them so that they can have it at home, so that they can understand it. Assure and reassure. We forget, to be the support they need. They're here, they're afraid. So you need to understand that, and you need to be very, you have to assure them, things will work out. It takes time. Tell them the truth. It takes time, but I'm here for you. And so you have to repeat that, saying, I'm here for you. If you have any questions, please call me, contact me. I am really here for you for whatever you feel that you need to talk about. Again, when, we had clients that the language they use is completely different from what they are trying to mean to you. For example, in Ethiopia, they have, I know it's in every culture, stomach is seen as, instead of, your head, they use their stomach. My stomach can hold a lot. What does that mean? Instead of I, think a lot, you say my stomach holds a lot. That means they're telling you all their problems because, they feel stomach has it's very large. It can hold a lot of things. So they pointed towards their stomach saying, my stomach holds a lot. That means they're telling you about their problem. Understand the language. Understand what, ask to repeat what they meant by that. So it's very important that you ask and, and understand what they meant by that. So this cultural sensitive part, I call it empathy, being empathic about it. We go out into bias. Bias is what I call confusion. It's, first of all, to help others, we have to understand ourselves. I understand, I have my biases, so when I meet with a client, I need to ask, and if they're talking about something that I think it's ridiculous or no, it doesn't happen, I can't say or, express that. So what do? If I know my biases already about that, who I'm going to be meeting, who they are from, or where they are from, or what kind of belief system they have, I can be able to say, okay, I understand what you mean. Then what can I tell you about, what I think? It's always more, it's easier to act on what you know, but it's, for example, like I said, if I know something about one culture in Ethiopia, I assume, that's the way it is because that's what I heard, that's what I know. But again, if I ask, I know they can tell me, oh no, I found, to be things I thought were general. I mean, that's how it is. I found out to be that that's not the case. There are differences within even that tribe. So we have to be careful and not to go on what we think we know about that, culture or country. Most of the time, avoid misidentification because, like I said, the language they use or what they say to you, it might not make sense when it comes to the medical aspect of it. So you need to understand where they're coming from. So, ask definitive question. Sadness. What do you mean by sadness? What do you feel? When does it happen? So you won't identify what they think is sadness into something else. We had a client, for example, who was, was suffering from schizophrenia, but completely, exhibited only, depression. It was, going along along with him, which at a later date, what the schizophrenia was really obvious. That was what's always coming out. Beware of your own expectations. You understand, you expect for people, so, that they can do. Do not express your expectations into what you want to do with the client. Like I said, patience is very important. So you need to understand, give it time, talk to them repeatedly. If sometimes they're ambivalent about something, try to keep, to talk to them in a different manner. Outside the setting, maybe, sit outside with them, go to their home. I did most of my visitations at their home because they are free. They do what they want to do. And in that setting, they start talking and I'm listening and I'm writing and they're fine with it. Same time, do not choose outcome for them. If they have depression, don't say that's depression. And I know what's good for you. You can take medication. We can refer you to this. I can do this, and we can help you with that. Do not give them time. Do not choose, medication for them. Don't tell them medication is good for you. Tell them that we can talk and we can see what's best for you. There are the ways. Give them the option of what other is out there for them beside, medication. We also list medication, what it does, what the medication can do, and for individuals. So that's very important. So that's bias is what I call confusion. Assessment, that is what I call clarify. Make clear what the appointment is about. You need to inform the individual why we're there, what you are there, what you want to do with the client, what you want to talk about, and what you want to address. Ask them, what do they understand about the situation? What do they feel about it? Then explain what you want to do and why. You need to give them a full explanation to what the appointment is all about, and at the end that you'll give them options. You'll talk to them about first, you want to know what their opinion is all about in the situation they're in, and then ask them, also inform them that yes, that you'll be doing A, B, C with them. So anything you have planned for that session, you need to inform them. They have to know, why, what was the purpose of you, what you're saying you want to do. Do a comprehensive assessment. It's very important, because asking them sometimes, our communities are very shy in saying what they want, or when you're asking them, do you have a house? They might tell you something that's not right. So you need to do a written assessment where print out housing, do they have a housing issue? Ask them, do you have a house? Do you have a government house? How much do you pay? Do you have work? So you have to assess each area of life. So you have to assess whether they are working, they have income, what kind of housing situation it is. And because in the future, you are going to build, that gives you the whole information about the client. The assessment, I do believe in assessment, because comprehensive assessment is the best thing I have done when I come to my clients. At the same time, you need to avoid pre-diagnosing individual where premature diagnosis, because most of the time what they present with you, because there is fear, there is, they're coming with ambivalence and all those things. They might sound, they are, this, but they might be, in the long run, you might find out different. So hold on in diagnosing the first time. Hold on from telling them, I think you might have depression. Hold off from that. You can do that in the long run, once you have built up that trust with them. So this assessment is what I call clarify state. Then the last one is a clinical presentation. That's what I call the formality state. We have to understand the language proficiency, okay? Because if you're not from the same culture, from the same country and speaking the same language from that tribe, that means you need a translator. That's a must. So how would you deal with that translator is very important. You need to ask the translators, what do they mean? Repeat what he just said, what he just said. Write it down. Repeat. Ask 2-3 times. Can you repeat that again? Because that's when you will find out if there is any discrepancy. So at the same time, for Western providers, I always say the language, English, some languages don't have, an exact English translation. So we really have to be careful with what we're asking and how we want it to be understood. Symptom presenting, like I said, people tell you different ways. They have different ways of symptom presentation. So make sure you understand what they mean by what they say. That is very important. Have a clearly stated treatment plan. Like I said, always combine. What has worked for me working with these cultures is that combine your treatment plan with the goal plan. Because if they don't have a job, you need to work with them to find a job. So, for me as a professional, I never say, I will, refer you to so-and-so, because the fear is there. So I'll start with them, write down their goals, and then I would refer them to a very good, I have to find out about different organizations. I go and check out every organization that does job applications, that, different organizations that are out there that I can refer to, so that I have to feel comfortable to refer them to. It's very important that, one of the first things I did was, what are the most common mental illness within this community. So I listed them out, and then I found out from each community how they see those symptoms. What do they say when a person has, if a person is acting this way, and all those things. So I will list out their feelings, their statements on the side, and I'll have the Western meaning of what that symptom is. So clearly, have those handouts ready for them so that they can go home. You read it. It's very important that you read it before they leave the office with them, so that they can have, clarity. Because sometimes, they take it home, they don't read it. They might throw it in the trash outside because they don't want the family to know. Or, if they are being forced by their spouse, by their family, to go see a professional, they might resent that. So they might not, they might deny that they have a problem. It's the family that has a problem, or somebody else, whoever. So if you read it with them, it will go across, and they do hear and they do listen. That's one thing that I found that brings them back every time, is because I let them decide, for what. I give them the information, and I just let them decide what they want to do. Hope this is helpful, and if you have any questions, you can contact me, or you can contact the members, and I can be able to answer any questions you have. Thank you very much. Bye.